Now, our first speaker of the day is Dr. Joanne Foody. She is the medical director of the Cardiovascular Wellness Center and Pollen Cardiovascular Wellness Program at Brigham and Women's Hospital. Dr. Foody has active and international roles in cardiac disease prevention and rehabilitation, with a particular focus on women and heart disease. Her research has focused on identifying and fostering greater use of clinical strategies that prevent adverse cardiovascular events in people with and without coronary artery disease. So we are delighted to be joined by our first speaker of the day. Please help me welcome Dr. Joanne Foody. Thanks for being here.
Thank you very much. Certainly a pleasure to be here. I don't usually get a band.
We'll make sure we get her mic turned on so you can hear her.
Is that better?
There we go.
Much better. So I usually don't have a band to introduce me, but we'd like to talk today about the evolution of patient-centered care and digital interventions within the ACC. So as I hope all of you are aware that the Institute of Medicine has put forth core principles that healthcare needs to be safe, effective, and patient-centered. In that context, we need to deliver care that is also timely, efficient, and effective. Patient-centeredness is a new mandate from multiple organizations and a new pillar within the college for managing how we might best approach our patients. And patient-centered care is defined as health care that establishes a partnership among practitioners, patients, and their families, where appropriate, to ensure that decisions respect the patient's wants, needs, and preferences, and that patients have the education and support they need to make their own decisions and participate in their own care. Now, if we think about the attributes that are required for patient-centered care, certainly we need to have access to care for patients. There needs to be patient engagement. There need to be clinical information systems that support high-quality, evidence-based care. And there needs to be care coordination. Ultimately, the care should be integrated and comprehensive in a context of a team care, and there should be routine patient feedback to providers. Finally, publicly available care should be required. If we think about the elements, we want to have enhanced clinician-patient communication, and a variety of the tools that we'll review do that. Health literacy needs to be first and foremost documented and assessed in patients. Clinician-directed patient education is one of the elements, as are shared decision-making and collaborative care planning. Ultimately, collaborative goal setting and patient empowerment and self-management are critical. Now, why do patient-centered care? We recognize a variety of research findings that patient-centered care improves disease-related outcomes and quality of life. It is known to increase patient adherence to medications, which ultimately leads to improved outcomes. And it can have the potential to address both socioeconomic and other disparities that we may see in care or outcomes. Ultimately, it is known to improve the efficiency of utilization of resources and may, in fact, reduce overuse of diagnostic testing and procedures. Now, how does this impact care? We know that patients and insurers and payers are seeking greater value from clinicians. Patient-centered care has mechanisms for assessing the patient experience, and that will ultimately inform reimbursement in the future. We also know that higher scores with respect to patient satisfaction and the patient experience lead to better brand identity and increase patient volume within your practice. And as I mentioned, reimbursements will be tied to these patient-level scores. Now again, what's in it for all of us, given that we have many challenges in our daily practice? That this should result in higher retention rates, higher provider and patient satisfaction, and ultimately reduce operating costs. There are some data that show increased market share as well as reductions in malpractice claims with practices that tend to use patient-centered care. Now, as I mentioned, reimbursement and incentives will be tied to patient satisfaction and the patient-centeredness of your approach. And whether it's through value-based purchasing or national quality strategies, ultimately this will be critical not only to providing improved care, but also to improving your metrics and assessment with respect to how you might be reimbursed. So the real issue is, can we use digital interventions ultimately to promote patient-centered care and provide a model for transforming care delivery in the context of patient-centeredness? So I'd like to review our efforts within the college around cardiosmart.org, which we hope will be a useful tool in your practices. And I encourage all of you to take a look at our website or visit the ACC booth for more information. This is an empowered approach to improving heart health. And CardioSmart, as it's designed, will empower patients and clinicians to partner effectively to achieve measurable outcomes and improvements in cardiovascular care. Our hope is that this will be a cutting-edge, trusted, integrated resource of tools for both clinicians and providers, and that it is based on ACC research. It will have disease management programs, and it will highlight the IHI's triple aim, which will enhance patient-provider experience, improve outcomes, and reduce costs. Let's see how these digital interventions might work in a patient. Shown here is a woman, 37-year-old, who comes to the office with palpitations. We recognize that this is often a challenging visit to have the discussion, and is quite time-consuming. What we aim to do with CardioSmart and the tools are that the patient could diagnose, for example, in this case, atrial flutter. The provider could use an iPad, for example, to explain what atrial flutter is, what it means from a physiologic perspective, what it means from an outcomes perspective, as well as what the potential treatment options would be. To extend the office practice, the patient could be referred to CardioSmart to review the decision that they may have regarding treatment or management strategies and ultimately prepare a list of questions for follow-up, thereby extending the office visit and reducing time, but allowing for a more prepared patient at a follow-up visit. A decision aid could be used. Like most decisions in medicine, very few are black and white, and most fall in a gray zone where we need to balance not only the evidence, but patient preferences and other conditions that may impact their decision. This is an example of a decision aid that has been used effectively, in this case in herniated discs, and has shown improvements in outcomes. But this kind of decision aid would be available on cardiovascular conditions so that patients could be more informed of their decision and their opinions and options. So in follow-up, you might see this patient come back, and you might use tools in CardioSmart to more fully review the decision process and consent process for an ablation, for example. And the hope would be that you would have a more informed patient coming in to the visit, and therefore a more informed, more satisfied patient leaving the office after that interaction. Catheter ablation could be performed. Again, the patient would be optimally consented for that process through these tools. And that for support following the procedure, the patient could engage in a community of other patients who have undergone this so that they could have adequate support and hopefully answer those frequently asked questions that may be quite time-consuming otherwise for us to deal with in clinical practice. So if we think about the outcomes of this kind of digital approach, we would want to say that there is high patient satisfaction of a fully engaged, empowered patient, that an approach such as this would help foster improved adherence and improved outcomes with respect to evidence-based therapies. Ultimately, our goal is always to reduce morbidity and mortality, and again, data demonstrates that an engaged, empowered, adherent patient is more likely to have improved outcomes. And finally, the hope would be is that by extending our care practice and using other resources available, that as providers, this could provide more satisfaction in how we may ultimately be able to deal with complex cardiovascular conditions and decisions in the office. We have other digital technologies. So this is a wireless health app that has been used to close the gap. And I think what we realize now is that everyone lives 24/7 in arm's reach of a wireless device. And as such, wireless devices, handheld phones as one of them, has the potential to be an important public health mechanism and approach to improving care. This is a slide looking at the Text for Baby campaign, which has over 50,000 subscribers of new mothers that helps provide improved care to individuals who all receive text messages postpartum. If we look at apps, for example, for children, this is a USDA rewarding of this particular app for healthy kids. And I think there are a lot of different technologies we can use, and we're hoping that CardioSmart will be part of that to provide ACC members and providers with tools to improve cardiovascular care. We're hoping that we can progress towards high-value care, which not only improves outcomes, but also addresses and enhances the patient experience and ultimately reduce costs, again, to provide the highest value care. So as far as members and looking at CardioSmart, we'd like to achieve success, but that requires your engagement and utilization of the tools. We'll be looking at a variety of tools to pilot test over the next years with a full launch at next year's annual meeting. And our goal is to ease the burden of practice by using these tools and by strengthening the provider-patient interaction. So I'd like to thank you for your attention, and I'd be happy to take questions if there are any.